continue it now. And Ellyn, is that correct? Okay, great. How are you doing this morning? And thanks for joining us on our daily show.
Yeah, thank you so much. I'm doing well. How are you doing today, CJ?
So much better because I did not ask for the pronunciation. I kind of winged it, and now we're doing good, you know?
Spot on.
Let's dive right into this. When it comes to medication-assisted treatment, I think there's so much of an opportunity to kind of educate the public on just the steps and what this looks like, and also the different type of circumstances in which we'd utilize this.
Yeah, absolutely. I do think that, medicated assisted treatment is becoming more widely used, and I think accepted in terms of a form of intervention for addiction treatment. We do use 3 different forms of medication, Vivitrol, Suboxone, and Methadone, to assist in treatment for addiction here at Centerstone. So those are the majority of the medications that we use to assist in that process.
Well, and let's just to go a little bit more into those 3 medications, when somebody is utilizing those to, help with their, combat their addiction and go through that battle, what are some of the different side effects, if you will, that maybe they will or could encounter if, they aren't, once they start, number 1, and number 2, if, medication isn't done in a continuous cycle?
Sure. Yeah, side effects I think are oftentimes one of the concerns that I think any person seeking medication for any condition is curious about. And a lot of times we don't have a ton of side effects that are negative in comparison to the substance that the individual is using. But a lot of times, particularly with the 2 of the medications that I referred to, Suboxone and Methadone, individuals can experience constipation is a big one, just because they are opiate blocking. Actually, Methadone is not opiate blocking, but that is one of the bigger side effects for opiates in general. So that is something that can be, concerning for folks, but we do always, have some suggestions and ways around that for sure. And we are very selective in seeking the dose that's going to work best for an individual based on the substance that they're using, again, how much they're using it, how frequently they're using it. And so really being pretty selective, like I said, in determining the right dose for a person. We want to minimize the side effects as much as possible.
Well, and I think that's you hit on something that I think is so important, and that was that the side effects of this are normally not as bad as the side effects of the substance in which we're utilizing. And so whenever someone's starting maybe this path, and maybe they have family members that don't necessarily understand the MAT side of things, the medication assisted treatment, and maybe just kind of have that older perspective of maybe we're just trading one for one. What are some of the things that maybe we can educate the family members of those folks about just the benefits of this as they're going through that battle?
Absolutely. I think that's an excellent question. There can be a strong bias, I believe, and we see it all the time. That an individual seeking, services is just trading one substance for another. We utilize an approach called a harm reduction approach. So really the medication alone is just a tool. We have an assortment of different services that we use to try to combat and aid in the recovery process alone. So we really just kind of like to look at the medication as a tool. And really, and I think it's all about perspective, right? We're trying to save lives at the end of the day. And if a medication helps someone or deters them from going and using an illicit substance that is very fatal, we're gonna shoot for using that medication as opposed 100%. To someone potentially going out and using a substance that could end their lives.
And if it's just because just to pinpoint this a little bit more, what do these 3 medications overall actively do when somebody's utilizing them? What are some of the benefits? What are the results of the medication?
Yeah, sure. Another excellent question. And
I'm 2 for 2. I'm telling you, I don't ask 2 good questions a show, let alone an interview.
You're spot on. And yeah, I can certainly kind of get into, the clinical pharmaceutical approach as to why we use, the different medications that we do, because they do all serve different purposes.
Mm-hmm.
With the ultimate goal being that we're assisting an individual from trying to prevent relapse or just trying to minimize craving and compulsion for their substance. So the three different medications again are Vivitrol, Suboxone, and Methadone. Vivitrol alone is a long-lasting injectable medication that the goal of that medication is to try to prevent relapse. So it really does try to block an opiate in particular. We do use it for other substance-related conditions as well. But so if an individual uses an opiate while they're on that medication, it's going to block those euphoric effects. So really, we're trying to train and retrain the brain to not respond in a reward way of, hey, this is actually really pleasurable. So we're trying to, train the brain, like I said, into not wanting that substance. Suboxone kind of does a mix of that as well, in terms of blocking the euphoria from the opiate that any individual would typically feel. But it also satisfies the receptor. I might be getting a little clear there, to where it helps minimize the craving alone just in using that medication. And then methadone is also a medication that we predominantly use, that we see people interested in and who do come to our clinic, which definitely it is a opiate alone, but it satisfies that receptor in saying, hey, I don't need anything else. So really, really decreasing the craving and potential risk of using an illicit substance.
Well, it's all really fascinating. And honestly, thanks for going into that a little bit more. And, I feel like the best, part of this conversation is it's all done in conjunction with individual or, group counseling to support, overcoming this. And to me, it seems like, you really can't have one without the other when it comes to this type of treatment path.
I would agree. Although, speaking of biases, I am a counselor myself. So, of course, I firmly believe in the process of counseling and, what it can do for folks. But kind of like I mentioned earlier, that the medication can be used as just a tool in the whole process of treating addiction, and more so in terms of like the physiological dependence that a person has on a substance. Mm-hmm. There is so much more complexity to an addiction than just the physical dependence on a substance. And that's where the group counseling and individual counseling kind of comes into play. Trying to process through some of those things, learning more effective ways to cope with life, right? We all need to learn new ways to cope with life. I think also having that element of community within the groups too, feeling as though I'm not alone in this. I'm not the only person that struggles with this. And I think the medication piece helps give people a jump start.
Yeah.
To being able to kind of access their brain a little bit more to engage in that therapeutic process.
Well, and see, that's really, to me, just such an important component of this. And Centerstone does offer methadone guest dosing, correct?
Yes.
And my question is, do you ever have an individual or folks that maybe are going, utilizing the methadone or utilizing one of the three? Do any of them become addictive or habitual for these individuals? And is that why the counseling side is so important? Just to try to, kind of pinpoint that too.
So speaking to the methadone becoming
does the methadone become addictive or habitual if not monitored, or how does that work?
It certainly has addictive potential, sure.
Wow.
I think that there are definitely individuals that could potentially have been their substance, use of substance of choice to abuse. So in terms of like determining a medication that's going to be right for them, we might not go down that road.
Gotcha. Okay.
And so it could absolutely become habitual. but again, we're always kind of monitoring the dose to determine what's going to be the most therapeutic dose for an individual. So whether that means like, do we need to increase the dose if it's not at a level that is satisfying their craving, or do we need to continue to slowly like taper down? And if the individual is engaging in other services and doing well, then yeah, we would definitely, and we do all the time, determine, okay, maybe we need to start taking you down off of this and taking the training wheels off, so to speak.
And it's really just fascinating just to hear the ins and outs of how this, treatment works. And, when it comes into just your patients and individuals overall, I'm sure that there's just a different variety of individuals from all different backgrounds and walks of life that are a part of these programs and treatments.
100%. I always say addiction does not discriminate.
Mm-hmm.
We see all different kinds of populations of people, all different ages, all different, races, gender. Addiction does not discriminate. And therefore, we have to, we do take into account like those unique traits and things like that in an individual. So we do, focus our treatment on their particular walk of life. And make it individualized per the person. But absolutely, throughout my career, not just at Centerstone, working with professional people, medical professional people,
Wow.
Parents, adolescents, it's all over.
Well, and see, how important is it to have, in your role, to have, an ability to just, have the opportunity to connect with those different backgrounds, because I'm sure that's difficult when you're dealing with or working with rather, multiple, age groups, multiple backgrounds, multiple poverty levels and stages of life. Is it a tough hat to wear sometimes, or how do you find that balance when navigating clients?
Sure. I think it can be. I think it can be a lot of pressure for counselors. However, not just at Centerstone, but I think within the field of counseling in general, there is a huge movement toward training on multicultural counseling, inclusion, equity, and being able to kind of change gears. So there is a lot of training and education devoted to that. So we can adapt and be flexible to the person that's sitting in front of us.
Well, and I'm sure everybody's timeline looks different, and whether or not it takes years or months or decades, what have you, that's not the important part. What is there ever a common moment that you have with folks where you can see that it's all starting to click, that lights come on moment, like the aha, we're getting there? What's that look like, and what's it feel like for both you and the patient?
That's an incredible moment. I would say that's what keeps us doing what we do. It is a challenging career. It really is. I think all of the staff, the team that we have here at Centerstone, are incredibly passionate and dedicated to the work that we do. But that moment, you are right. It is pretty evident when the pieces of the puzzle just start to click into place. We might have gathered a lot of information and built a lot of coping skills and supports and things like that. But once it starts to really come together and click, the sky's the limit at that point. Things just start to fall into place for that person in their life. And it's pretty incredible to watch.
I couldn't imagine. And just because I find this component fascinating too, is there a lot of times when you're working with folks, how much does internal pressure come into play with, maybe wanting to be fixed tomorrow, or, wanting this all to go back to normal like it was, 5 or 10 years ago? Does internal pressure affect the individual more, or is it external pressures like, relationship with loved ones and their family members? What do you see more of?
I don't necessarily know if there's any pressures that stand out more than others. The combination, absolutely, for sure. And each individual is probably going to feel pressure differently than others. And we definitely do. We have clients that come and seek services because they might have been encouraged by a loved one or, a family member. But what you're speaking to in terms of those internal pressures, we do see that. We do see that a lot. I have a lot of clients that I just want to be who I was.
Yeah.
I want to be rid of this. I want to make up for lost time. And what I always try to do in terms of changing that perspective is, as human beings, I mean, when we're going through time in our lives, we're always changing. We're never going to necessarily be the person that we once were. We're going to be evolved into something different. And that might look even, more wonderful and beautiful than what you were before you started using substances.
Well, and honestly, it's one of those things, I think, that even if somebody, is not going through that, even folks just watching at home, anyone could connect with what you're saying there about, the changes of the season, if you will. And, whenever we're talking about individual and group therapy, are both of these components not required, but part of the rubric? Is it individual and group therapy, or is it individual and or group therapy when it comes to the overall process?
Yeah. It kind of depends on where they are in terms of their level of care.
Gotcha.
So what we provided at Alton specifically, our location in Alton, is we have an intensive outpatient program and an outpatient program. Throughout the whole state, we have all different levels of care. But to answer your question, it is an and or.
Okay.
We really do want the client to be driving the car, meaning, we really have client-centered care. We want them to have a say in the services that they desire and what's going to be effective for them. So we have the options for all of these different kinds of services, and we encourage them and recommend them, and but they ultimately have the decision on whether or not they want to engage in those things.
100%. And before I let you go, what's your final thought just on MAT overall, and just anything else you'd like to share with our audience before we say so long for now?
Sure. MAT, medicated assisted treatment, I do think that it does. It has a bias associated with it, but I think it has really been instrumental in saving lives. And again, at the end of the day, that's what we're shooting for. We all have the ability to make changes in our lives if we still are breathing life, right? And if a medication can assist a person's process in doing that, then, like I said, the sky's the limit. And we have a lot of other interventions and services that we can do to assist in that process. Overall, I think Centerstone, like I said, our team is very passionate and dedicated to this work. From the directors to the customer care service people, recovery specialists, nurses, counselors, we all together as a team try to uplift and build hope for people. That's ultimately what we're trying to do at Centerstone, and save lives at the end of the day.
100%. Well, thank you so much for stopping by. It's been a great conversation, and I hope we get to talk again soon.
Thank you so much, CJ. It was my pleasure.
No problem. We'll take a quick break. To find out more information, you guys can go to centerstone.org. That's centerstone.org, or just give them a call, 1-877-HOPE-123. We'll take a quick break. More Daily Show on this Wednesday morning comes right around the corner next.